So, how do you like your women? Slim, athletic, voluptuous.
What was once virtual reality is now the #1 procedure in the land.
Athletic.
329,000 women last year alone.
41A, Ernie.
If only fixing a bad breast job was so easy. Busty babes may sell magazines or dazzle Tinseltown, but in real life, bigger's not always better.
The larger the implant is, the more chance there is that over time the breast will become distorted, the tissue will become stretched.
Board-certified plastic surgeon Dr. Stephen Goldman says many women are selecting too large of an implant.
A large implant puts more pressure on the breast, the muscle, and the skin. So over time, there's the potential to have more stretch and stress, which basically means, in a way, you're going to age the breast.
It was very traumatic.
Allie got her implants after surgery to remove cysts left her deformed.
One of my breasts was concave.
She asked us not to show her face, but wanted to share her story.
I have a small frame, and he went quite large.
Allie developed severe capsular contracture.
So that's when the scar tissue envelope around the implant tightens up. It can even calcify. It can become hard like an eggshell.
This is what it looks like. On the left is the calcified scar tissue capsule that had formed around the implant on the right. Allie says yes, it feels just as bad as it looks.
Pain and actual distortion.
And there are many more potential problems. Malformed breasts, leakage, rippling, odd scars, and numbness.
Implants can become infected.
As bad as all of that may sound, there is one complication that every woman should be aware of, not only because of the pain it can cause, but the potential scarring, even disfiguring a woman for life.
The most unusual and worst complication I've seen is a patient who had a breast augmentation elsewhere, and the implants were both too large and actually eroded through the skin and got infected.
The implants literally pushed through the skin, leaving the patient scarred even after corrective surgery. Allie's reconstruction was much better.
I'm very happy with them. They're similar in size. I feel that they look a lot more natural than my other ones, and I don't have any pain anymore.
She warns women to do their research, only use board-certified doctors, and realize, even with the best results, breast augmentation surgery is not a one-time deal.
I, for instance, will present this to a patient as a procedure that will get repeated later in life in some fashion, or revised is a better way to put it.
Be very realistic about your outcome and your expectations. Everybody's different, and they can only do what they can do with what they're given.
Suzanne Stratford, Fox 8 News.